All right, remember we are live on Facebook, on Twitter. We are live on our website, www.kbc.co.ke. Moving on, I'm also joined live by the United Nations Habitat Executive Director, Maimuna Shariff. Thank you very much, Maimuna, for joining me this morning. We are at a time where we have the pandemic. It has plunged the world's economy into a global recession. So far, what is the UN Habitat's focus?
Thank you very much, Ram, for this morning, and Khabaria Asubuhi,
Zuri sana.
and Ramadan Kareem for those who are fasting today. A very good morning. Our main focus is on the 1 billion people worldwide who live in the informal settlement and slum. And in Africa, this amount to around 200 million, or half of those living in urban areas. So these are the most vulnerable who urgently need our support. So as you know, there have been some cases on COVID-19 confirmed in Kibera, Dendora, and Kawangware. So we need to be very vigilant, and let me take this opportunity to acknowledge the hard work of the Kenyan government, civil society and community organization, particularly women and youth group, as they are providing much needed basic services. I also would like to particularly want to mention the policy Kenya Water and Sanitation Ministry to ensure people water for hand washing, which is so essential to prevent the spread of COVID-19. In particularly, they are also providing free water to vulnerable group for 3 months, and not carrying out disconnection and prioritizing areas that needs intervention. These are very excellent measures. And also, I would like to congratulate the government for establishing the last coordination COVID-19 response in informal settlement, chaired by the Department of Housing and Urban Development, to coordinate actors intervening in informal settlement. So this is a major step that will draw attention to this group, which is particularly vulnerable. So we have even more vigilant now, that I am happy to report that the group that we are working with have been helping us to ensure that the most vulnerable residents have access to hand washing facilities and get life-saving information about COVID-19. So, but let us not forget, another thing is the financial challenges of this community. Then they are facing living in slum, rely on the daily informal work, and with the lockdown, lack of transport, and also the closure of business, market, and other places, and they cannot make a daily wage. So these are the things that we are focusing now. Ryan, over to you.
All right, and so far, thank you very much for that, all these plans that you have. But when it comes to the policies and the measures to mitigate, what policies do we have so far? The measures that are there to mitigate the local, social and economic impact of this virus?
Yeah, we have this 19. You can see that UN Habitat recently launched the UN Habitat COVID-19 response plan, and this is we are focusing, as I said, on the sustainable development of cities, towns, and communities. And we know that the huge number of cities affected now, nearly 1,500 at the moment cities are affected, and 90%, 95% of all COVID-19 cases are in urban areas. So, and we know that particularly we have to act quickly, particularly in the slum and poor areas. So for us in UN Habitat, we already launched the plan last Thursday to work with 64 countries across the world, including 20 in Africa, and to carry out work in 2020, we need around 72 million. And for the immediate action, we already allocate our own funding, and of course, it's the member state funding of UN Habitat, 1.3 million, and 13 project immediately, in over 13 project globally, including in and most of those be treated and to improve their water and sanitation. This is very important when you ask about washing hands. So if there is no water, how to wash the hands? So it's water and sanitation is setting up hand washing facilities. And we also raise awareness about COVID-19 because there are a lot of misinformation and the lack of trust in what people are hearing. And we also use our expertise to help government to make key decisions about which area to prioritize and how to react by collecting data and mapping the hotspots. And we also using the looking for the innovative way to help those hit in the hardest and the economic impact. Let me give you some example. In Kenya, UN Habitat was selected to provide technical input to the technical committee of the coordinating mechanism of COVID-19 response in informal settlement, chaired by the Department of Housing and Urban Development, established by the government to coordinate actors working in the informal settlement.
And
we have years of experience, yes. These are the things that we are looking for, right? Over to you.
Yes, yes. The UN Habitat launched an urgent COVID-19 response plan for different countries. You're focusing on different immediate action in poorly and densely populated areas. Maybe you can be able to give us just a brief plan or a brief overview of what this plan entails and how is it going so far, the COVID-19 response plan?
Yeah, this plan is about the our work, especially in the most vulnerable areas. Because let me give you a certain data first before I discuss about the plan. As I mentioned just now, nearly 1,500 cities in 210 countries affected by COVID-19. 90% of the total cases in urban area. 1 billion people live in informal settlement, slum, in overcrowded and inadequate housing. 2.4 billion people lack of adequate access to safe water and sanitation. And we need 72 million needed by UN Habitat to help meet the urgent needs of these cities. And we are looking into three areas, three response areas. One is to involve with the community to look for the innovative driven solution. Second is look into the urban data because a lot of data are missing for the decision maker to make a decision, and mapping and knowledge. And the third, of course, is looking into the mitigation economic impact and initiate the recovery. So we globally, we are looking into 20 countries in Africa, in Arab State, 11 countries, Asia Pacific, 70 countries, Latin America, 16 countries, and the total is around 72 million for the to put more facilities, immediate facilities for to tackle and also to prevent the COVID-19. Over to you, Brad.
And with this continuing spread of this coronavirus, I would like maybe to find out from you, we have different cities, some vulnerable, some poor, all over the world. It has affected communities, particularly the 1 billion people living in slums and informal settlements, including refugees, internally displaced persons, and migrants. Now, what are you doing to address the crisis and to help cushion these affected people that are over 1 billion?
Yeah, thank you very much for that question. This is very pertinent question that I would like to give some example here. Our work, our main area, how we can trying to flatten the curve of the COVID-19. Let me look at maybe is in our work in Africa. We are supporting 20 countries in Africa: Kenya, Ethiopia, Somalia, Tanzania, and South Sudan. And we are looking into the emergency response to the outbreak in the informal settlement and crowded marketplaces. UN Habitat, among others, is also in area of awareness raising, access to water and sanitation and hygiene facilities. We are looking at waste management, mobility and connectivity, and how we can sustain the basics income. Look at it, the alternative energy, data and information management and policy and strategy advice, and see how we can look into the social cohesion. So this is the one of the area that we would like to help. At the same time, we are also working very closely with the communities and also with the youth in the countries that I'm mentioning just now. And one of the areas that we can see is just very near to our place is the work in Kenya in fighting the COVID-19. We work very, very closely with the youth and the women in Kibera and Matare in giving the facilities hand washing station, and Habitat has established 10 washing hand station as well as this is well attended by the communities, and we are supporting youth group. At the same time, we also working with the private sector. We managed to get, I would like to say thank you to Chandaria Foundation. We managed to get another 20 stations in the e-commerce station, and I was informed, Ram, that is already over 135,000 hand washers at the facility so far. And we would like, what we want to do is in a response plan, we would like to collaborate with the member state, would like to collaborate with the private sector, with the philanthropies, with the organization to scale up these facilities in the informal settlement in Mombasa, Nyeri, Kisumu, Nairobi City, Mandera, and Nakuru. Well, now, I also would like to say thank you to the Canadian and Norwegian government. They have established 28 stations in the two informal, and with another more 15 planned, I was told. So this is a few areas that we are the quick win that we would like to do, and this is very, very important. Over to you, Ray.
Yeah, you've mentioned different governments there, but now it brings me to find out, how are you working through to mobilize support amongst the different national, city, and local governments and community leaders?
I would like to call upon our partners. That's the reason why first thing we started with the 13 project and with 1.3 million that we just immediately, we already launched it immediately after the COVID-19. And then we plan and we launch our COVID-19 response plan. In the COVID-19 response plan, you can download from our website. We put down what we want to do, and I will also take this opportunity, Ram, to call upon our partners. And apart from we have the consultation bilateral with them, we also have also online webinar calling for the partners to work with us. I'm also using this platform. Thank you very much, KBC, to get the partners to work together with us. Let us collaborate and unite and increase our solidarity in fighting this challenging time of COVID-19.
And so far, the UN Habitat, you have over 40 years of urban experience, and much of it is in humanitarian situations. But now, how are you working with just still to dwell on this, to dwell deep on that, how are you working with the partners now who are on the ground to urgently deliver the $72 million for the response plan in Africa, the Arab states, Asia Pacific, Latin America, and the Caribbean?
Yeah, there are two methodology or two strategy. One is we are working very close with our United Nations country team. We are working very close with UNCT here, with the resident coordinator in Kenya. for example. And we're also working with the resident coordinator in other countries that I mentioned just now, in Arab state, in Asia Pacific, Latin America, together with that. And we are also work through this UNCT, or United Nations Country Team. We work together and we with other UN agencies in delivering this program. Even our program with 1.3 million project, or the 13 project, we also partner with UNCT. And second is we partner with other philanthropies. For example, like immediately after we launched this COVID-19 response team, we have already had yesterday were announced that the Al Walid Foundation from Saudi, they're already willing to fund 2 million of our program in Arab state. So now we are calling for the partners to work together with us. And we have a very clear step and very clear methodology and very clear program. All these 72 million, if we can get it, we have a very clear program of what we want to do. And also with the indicators and impact on the ground, so that we can see what are the impact of our program, and we can also scale up and also asking other partners to work together with us. Over to you, Ram.
All right, and you are working with 20 countries, and this is in Africa. What are the priorities that were made in narrowing down to these 20 countries in Africa?
We are working in the 20 countries. If I can list it to you, that we are working with Angola, Burkina Faso, Cabo Verde, Cameroon, DR Congo, Ethiopia, Gambia, Ghana, Guinea-Bissau, Kenya, Mozambique, Nigeria, Sao Tome and Principe, Somalia, South Africa, South Sudan, Tanzania, Zambia, and Zimbabwe. So these are the 20 countries that we will work together with the government, with the mayors, and also with the communities. If we can get the funding that we are launched the appeal on last Thursday. So these are the areas that we are putting up for especially to work in the informal settlement and the crowded marketplaces, and the most trying to look to help the most vulnerable people within these countries.
But now in these countries, because Africa has 54 countries, how are you able to narrow down to the 20, considering that some countries are different from the rest? What were the priorities that were given when it comes to coming up with the 20, especially also looking at the effect of this COVID-19? How was it working through to get to that?
Okay, these countries that we chose is one criteria is that we already have the country present, UN Habitat country present in this country. That's one criteria. Second is we already have started our program, existing program in this country. So we are not starting from scratch. So we are already have the collaboration and engagement with the cities and with the government of these countries. And then we're also looking into the vulnerability in terms of the people in the informal settlement and also the informal sectors of this area. So these are we have the criteria when we chose the 20 countries that we would like to work with. So this is more on the demand driven. We have the communities, especially in the informal settlement and local government, have come to us and requested support. And national government also asked our support, especially in the urban poor in informal settlement. As we know, this is where the virus is most likely to spread uncontrollably. So even we already have 4 projects in Africa at the moment, with our own funding in Kenya, Ghana, Mozambique, and Guinea. So there are a few factors that we chose these 20 countries. Right, over to you.
Now, let me narrow it down to some specifics. We have over 95% of the world's coronavirus cases being experienced in urban areas, with nearly over 1,500 cities affected. What are the possible measures that can be put in place to slow down the transmission, such as, we have physical distancing, self-quarantine, hand washing, and community-wide lockdown? What other measures what are the measures that we have so far that people need to implement to reduce the rate of transmission?
The response to the COVID-19 at the national and city level must suit the local context. For example, informal settlements are diverse, local living conditions and people needs are different. So physical distancing is difficult to practice for the highly populated neighborhood like slum, where people interact as part of economic. But more practically, there is no adequate space in the houses and streets are narrow. So the clear way I think that's ahead is to work through the communities. And UN Habitat has excellent network within the communities who have the best information and innovative ideas about what can work and how to get the message across. So we have seen impressive creativity with innovative approaches made to make face masks, hand washing stations that are inexpensive, and these communities taking messages door to door. So we need to listen first, then we act, because there is no one shoes fit all. It depends on the localities and the values, the culture of the various cities and various communities. Over to you.
Now, Madam Maimuna, I would like to quote what you said. You said this.
Yeah.
And I quote, "With our extensive network of partners as well as our in-house experts, UN Habitat is working closely with the cities and communities to find innovative and targeted solutions to provide water and sanitation and safe transport to mitigate the economic impact of the urban poor." End of quote. That is what you said. But now, being that you've done this in the communities, what is the response from these communities on the ground?
Oh, Ram, the response is I told you earlier when you host me, I'm on the WhatsApp group of many youth and many groups. They want more. Please, Edie, can you escalate? Can you scale up the facilities that you have now? How can we work? There are both ways. I have a youth from Nakuru, from Nyeri, from Mombasa, who told me that we can do this cheaper. This is also increase the innovation of the youth. So their response is very, very good, and they would like us to give them more and empower them, because they know what is needed in that area. They know where to put for example, the hand washing station. They know how to manage them. Then I also ask them to collect the data, so that in future we can also do the analysis. We are not only talking about during COVID, Ram. We are also now I'm putting out one task force in my organization to look into post-COVID. What happened after this? How can we is it business like normal? Because now it's new normal. I used to be in your country doing this interview, but now I'm at home. So I think this task force will be looking at the data that we gather from the work on the field. So my answer is that they appreciate it and they want more. And I also would like to appeal today that please collaborate with us, all the member states out there, the partners out there, the business group, and also the philanthropists out there together with us, so that we can strengthen up, we can scale up our activities and our facilities on the ground. Over to you, Raj.
Thank you very much. That's all the time we had. Thank you very much for finding time to join me this morning and airing your opinion on mitigating COVID-19.
Thank you very much, Aram, and Asante Sana. Thank you.
Asante sana, ubarikiwe kabisa. That is UN Habitat's Executive Director, Maimuna Mohd Shariff, coming to us live. Remember, it was about mitigating the COVID-19 effects. She has given different highlights. Remember, you should be part of this conversation. The hashtag, as always, is Good Morning Kenya. We are live on Facebook. Keep your comments coming in. Tag me at Ramaguko, at Dorina Range, and at Jane Wambui. Meanwhile, we're taking a short break. We'll be back in a bit. Keep it Good Morning Kenya.